Good afternoon, everybody, and thank you for joining us. I know I'll give it a few minutes because people are just joining now, so I'll let the people join. How are you, Victoria?
Not too bad. Well, run off our feet, actually.
I bet. Making sure you have some stock and so on and so
Oh,
on.
I tell you, it's
Yeah,
mad at the minute. The phone lines are
yeah.
hopping.
Okay, brilliant. Well, look, I'll tell you what we'll do. We'll give it a minute or so because I can see the numbers are clocking up
Yes,
of the participants. And when we get to a kind of a stable number, we'll start because there's
sounds good.
absolutely massive interest in this as a topic. Absolutely
Yes.
massive interest, which is incredible. And all right, so I never thought the day would arrive that we'd
No,
actually
either
be
did I.
saying
Not. Yeah, it's come
that.
quicker than anticipated.
Exactly. Okay. Well, I'll tell you what we do. We're up at about 76 people there, and we let that keep running for another
Perfect.
couple more. And I think we've something like 280 people or something registered,
Great.
which is
Yeah,
phenomenal.
it is
Phenomenal.
phenomenal, and it's great. Women are so good at starting to, I suppose, get the education, pop into webinars and things like that, and yeah, it's great.
Exactly. Okay. So, good afternoon, everybody, and it's absolutely my pleasure to be hosting this webinar today, which is about free HRT, which comes into effect on the 1st of June. And I'm thrilled to be accompanied today by Victoria Jones, and she's also known as the Menopause Pharmacist, and she runs Bonnybrook Pharmacy, or owns,
Mhm,
and is a fantastic advocate and campaigner in this space.
mhm.
And she also has a lot more of the information to hand, being a pharmacist herself, than we have. But it's always good to get the experts involved and share the story. So you may want to introduce yourself, Victoria, and say
It's
hello.
So afternoon, everyone. So exciting times ahead for women's healthcare. So finally, HRT will be free for the women of Ireland. So it is such a great day, and obviously with Loretta and everyone else lobbying for this, it does take a little bit of time, but we finally got there. So there's probably more questions than answers at this point in time, but nothing, you know yourself, when the government roll out something, this tends to happen. So the government have rolled it out so that it's going to be live from June 1st. So really, the computer systems just aren't ready just yet. So you'd normally be able to get your month supply earlier, but just not yet. So our computer systems still aren't ready. So, but after June 1st, it will be, which will be great for the women of Ireland.
Brilliant, brilliant. Okay, so we're going to start the webinar with all the details proper now. And so tell us what's happening on June the 1st.
So on June the 1st, the women of Ireland will be able to get their HRT for free. So that will encompass your hormone replacement therapy journey, as long as it's a hormone. So from each day going forward, we're getting updates from the HSC and our union, just to make sure we have a smooth rollout. So because hormone replacement therapy is quite a complex thing, and as you know, every woman's journey is different and every woman's medication is slightly different. So it's quite a complex scheme for the government to start with as a free service for women. So we have lots and lots of FAQs and questions that we're coming in fast every day. So basically, once you have been prescribed HRT, from the 1st of June, you will be able to go to any pharmacy in Ireland. So if you are in Cork, you can go to a pharmacy in Dublin, Ireland, anywhere you'd like, in the Republic of Ireland, and get your HRT for free. So there will be a couple of little caveats with that, but most of the time it'll be totally free.
Okay, so let's imagine I'm on HRT, which I am
Yes,
actually. No, I don't have to imagine it, but let's imagine I'm rocking up to your pharmacy,
yes,
and say I normally have my drugs, my medication every month
payments.
in a
Yes,
different
yes,
pharmacy. So I'm not a medical card patient. I'm part of the DPS scheme.
yes.
So I rock up to you, and we're coming on to the caveats in a minute. So I rock up to your pharmacy, and I give in my prescription. What happens?
Well, it'll for the first few days, I imagine there'll probably be a little bit of mayhem. So I would suggest that if you don't need your HRT for the first few days in June, just give the pharmacist a couple of times to recalibrate, because this is going to be all new for us. And as I said, the computer systems aren't ready yet. So just say you're coming into me on the 10th of June.
Yeah.
Your prescription, you can basically come to any pharmacy in Ireland. So even if you're not normally a Bonnybrook Pharmacy patient, you can come here and get your HRT for free. The reason we're asking women to sign up to the drug payment scheme is solely because the government need to be able to track it and pay the pharmacist for it. And the only way they can do that is through people's PPS numbers and the drug payment scheme. So as I said, it is a quite complex thing, but they've decided that this is the best way. So it'll be completely separate from your €80 that you may have to spend in a different pharmacy. So if we say maybe your husband and children and yourself get medications at the moment in a pharmacy in Ireland, and it is €80 and you're spending over that, the HRT will be completely separate. So you can still get your €80 worth of your medications. You probably end up spending, you would have maybe worth €400. But your HRT prescription doesn't need to be in that same pharmacy. You can go anywhere you like because it'll be free. So there's no cost associated whatsoever, but we just need to have a drug payment scheme card set up, and that's just a way for us to claim through the HSE.
Okay, so first things first, you should be part of the drug payment scheme. So what I'm
Yes.
going to put into the chat now, if I can find it, is where is the bloody chat? I wanted to put in a link to, oh yeah, here we go, the chat. Here is the link for the drug payment scheme to apply. So
Yes.
you go on to mydps.ie. So you
Yeah.
need to be part of the drug payment scheme.
Yeah.
If I'm a medical card holder, what happens?
So if your products are covered under the medical card, so for instance, if your Eastergel has normally got a code on your medical card, nothing will change, but you won't need to pay the €1.50 levy. But if there's anything that's unlicensed, so it's quite complex because we have huge issues with stock in Ireland of hormone replacement therapy products. So in those circumstances, we often have to buy a product that just isn't licensed here. And all that means is the company hasn't done the paperwork to get it licensed here. So they might find that Ireland is too small a market for them to license it. They might say, so we might bring in a Spanish product or a French product or a UK product to make sure that the Irish women have their HRT supply. But because the government haven't assigned it a code for the medical card, those women will need to have a drug payment scheme card also. Now, financially, it doesn't mean anything to them. It will still all be free, but for the pharmacy to be able to give it to them, we just might have two systems where we need to put it through the computer systems. So for most people, there won't be any change. But if you want to be able to avail of anything like the unlicensed medicines, if you have a medical card, you will also need to sign up to a drug payment scheme. But again, it won't cost you anything. It is just a scheme number for us to be able to claim.
Okay, brilliant.
Yeah.
And there's loads of questions coming in and we'll come to them in a minute. But what I wanted to ask then next was, so what products are covered on this scheme?
So it is changing. So only yesterday I was sending updated emails to the HSE checking because there is lots of omissions. Now, so at the moment I'm holding 3 A4 pages full of medications. And as I said, because we have such shortages in Ireland, and we will be for patches and things like that for the next 2 years, we're bringing in quite a lot of unlicensed products from the UK and Spain and even America, would you believe? So they just don't have codes. So there is basically at the moment, Easter dots will be covered, all of your vaginal estrogens will be covered, apart from Invagis. All of the oral estrogens that women take will be covered. So all the regular things that are currently covered under the medical card and drug payment scheme will be covered. So Testagel, a testosterone is going to be covered, but not the androfen version, which is the Australian version. So all of your Ovestin creams, your Fagifems, your patches, your Lenzettos will all be covered. So there will be some weird and wonderful things that are outside the scope of being covered. And we are querying those with the government and we're waiting for them to come back to us with the full implementation list. But as I said, it is a very complex issue. But most of the time, your HRT will be covered.
Brilliant. Okay, so that seems like great news in that
Yes.
regard. So I see things like Blicelle are on it as well,
Yes.
and
The
yeah,
Marina.
Marina coil is
Yeah.
on it. Yes.
Yeah. But the other coils wouldn't be covered because they're not
Yes.
used for hormonal replacement therapy.
Absolutely. Ovestin is on it.
Yeah.
The, as you said, the oral HRT, all
Yes.
the progesterones are on it, so Utrogestin
Yes.
and so on. Is, I presume, the one that's the, what's the name, but the one that's the synthetic progesterone, what's that called?
Dufaston is covered, yeah.
Ducafastin is covered.
It is.
Brilliant. Your
Yes.
Testogel, your Tostran, okay,
Yeah.
your Utrogestin, your Vagifem, your
Yeah.
Vagirux. Okay, so that's fantastic. So almost everything. So I know in my instance, all my products will be covered.
Yes.
So if something isn't available, so we'll say the Estradot 50 patch is in short supply, so or is out of stock or whatever.
Yes.
So and I have to get something else. What will happen then?
Um, this is what we're getting to grips with. So as I said, because it's being pushed through quite quickly by the HSC, we have lots of questions that are unanswered. So there certainly is some products, like I'm looking at the list here, and we have Everall is the Irish product, this one here, and it's licensed in 50 micrograms in Ireland. You can see that. So that's in and out of stock in Ireland all the time. So will the unlicensed version, which is just the UK box, be covered? It's not on the list. But yet a 25 milligram patch seems to be covered, but not the 75s or 100s. So that's a bit of a funny one. So there's lots of questions that have still to be answered about unlicensed medicines. So when things go short. So really that only really applies to the patches. Really, the
Okay.
Lenzetto, the gels, the Divigels, and all the vaginal oestrogens are more or less constantly in stock. So if anyone's starting on an HRT journey, I would strongly advise against starting on a patch because we are going to have ongoing problems for the next 2 years. And the company have said this, and it's on the HPRA website, so it is out in the public realm as well.
Yeah, they've actually said on the HPRA, which is the Health Products Regulatory Authority, on their website, so the shortages of the 50 patch and the 75 are up until December this year
And even
coming.
then,
Who
very
knows?
small quantities are going to be coming into the Irish market. So we might only get 1,000 boxes, but we might need 100,000. So
Okay,
that's the crux of it.
brilliant. So then what you're saying is if we go to so we can go to any pharmacy with this,
hmm
right?
Yes.
Yeah, brilliant.
Yeah. So go to a pharmacy that is able to keep you in stock and is actually menopause trained. It's really important to make sure that when you do get your products that you're actually properly counseled. So the amount of times I see women come into me and they say to me, my gel didn't work for me or my Lenzetto didn't work for me. And I say, okay, and they say to me, well, I got it somewhere else. And, the female or male pharmacist didn't tell me how to use it and they've been doing it completely wrong because they weren't counseled on it. So make sure that you're using it correctly is really important. The amount of times we see people taking Utrogestin in the morning with a meal when it should be taken on an empty tummy in the evening. So make sure that you're going to a pharmacy like Bonnybrook Pharmacy, that you're actually going to get the proper advice and care with it.
Okay. And then the next question I have is there's a few questions here, right, which will
hmm
help. So it says, sorry, there's a question here. Sorry, give me a second. Is there a central system where pharmacies can check if you're registered on the DPS, or do you have to register with each pharmacy?
Oh no. So we have a centralized system. So we have a secure scheme checker. So every pharmacy in Ireland has the same one. And so your drug payment scheme, it's like your PPS number, it's yours. You can travel with it to any pharmacy. It does not have to be assigned to one pharmacy, especially for the hormone replacement therapy, because there's no cost. So you can go to any pharmacy you choose. We've seen a huge uptake of women coming through to Bonnybrook Pharmacy, whereas in previously they had been tied to a pharmacy maybe in Brahini Artane or wherever, because that's where their family got their medications. But now it's going to be completely separate because it's free. They can come over to Bonnybrook Pharmacy and we'll be happy to facilitate them.
So if I go into you and I say I don't really, I'm on the, I'm part of the DPS, but what information do I need to give you for you to check that I am
Just
or not?
either your DPS details or your PPS number. We can easily check
Okay.
it.
Okay, so here's
Yeah.
my recommendation to every woman, actually, well, to every person is to learn your PPS number off by heart or to put it
Yes.
somewhere in your phone that no one would be able to, if they stole your phone or found your phone, they'd be able to find it. But it's so that you know that number and they have that handy or put it in a
hmm
slip of paper or something in your handbag. But I know my PPS number off by heart and have done, and
Yeah.
my kids' numbers off by heart. So I would recommend that people do that. And therefore that can be checked if you're on the DPS scheme. And if you're not,
Exactly.
then you go to that mydps.ie and register now.
Yeah.
And the second question, so that hopefully answers that. What happens if your prescription is emailed from your GP or your menopause specialist, which we do for a lot of women, and you
hmm
don't have a copy of it? Can you still go to another pharmacy for your HRT prescription, especially if your pharmacy is out of stock?
Yeah, absolutely. So your prescription, so Health Mail was a great email function that was set up during COVID, which was super. So doctor can email it to any pharmacy. So A, you can ask them to send it to any pharmacy, but if it's already in an existing pharmacy, it's just an email. It's just a secure one for us. Your pharmacy can literally hit send, it goes straight to Bonnybrook, and I will get it instantaneously. And then that's it. That's all you need to do. It's very, very, very simple. It's
Okay, poor
yeah,
pharmacists will be absolutely inundated and doing work. And
yeah.
so what they're saying is if your GP or your medical specialist has sent your prescription to a pharmacy and you can't get the product there, what you need to do is to suggest or say to them, can you, I'm going to go to wherever,
Hmm.
can you send on that prescription? So you
Yeah.
don't
Like
need, yeah, you don't need a
you don't need
physical
anything else.
copy. Yeah,
No, a physical copy is great. So all the HRT is obviously all on prescription in Ireland. So that's the first thing. So you need to have a valid prescription. So we need either a physical prescription that was signed by your doctor or a health mail, which is just that secure email. And it's so simple for pharmacies to transfer between. So and it's your choice as a woman of Ireland, and any person in Ireland can choose to have their prescription sent anywhere. That document is yours. So just because it's in one pharmacy's email doesn't mean it can't be sent to anywhere else. So it's
yeah.
really quite simple.
Okay. And can I ask this question, which is,
Yes.
just say I go to my local pharmacy and where I normally go, and I get my HRT, I get two things, but the
Yeah.
patches are out of stock.
Yeah.
Can I go somewhere else to get that patch
You can. So ideally, you would get all of your HRT items in the
in
one
the one
pharmacy.
place?
There's no
Yeah.
point in giving half the business to one place. It's like going into a restaurant and saying, I'm going to order the potatoes here, but I'm going to go next door and get the steak, and then I'm going to go next door and get the vegetables. So really, if we're
Okay.
going to the trouble of fixing it and doing it for you, really just go to the one place.
One place. Okay.
Yeah.
And the next question I have for you is, I get my prescription and say it's for 6 months. Can I go in and get my 6 month supply?
No, so because it's a free government scheme, just like on the medical card, it is 1 month at a time. And especially at the start, because the computer systems are not ready. So for the first 3 to 4 weeks, we're being told that we're having to use a workaround on the IT systems, which means we'll probably have to do a lot more data entry at the end of the month. So, from a person's perspective, going forward, they can only get 1 month for free from their pharmacy at a time.
Okay. And then the next question I have is it confined to, the way the free contraception was rolled out to different age groups? Is this
Mhm.
confined to any
Nope.
different age group? No.
No, so it encompasses if you have been prescribed HRT. So some women have ovarian failure quite young, so POI, so that could be some women are on it at 25. If you're in the perimenopause, 35, 36, 37, or if you're in menopause, 45 onwards, there's no age guidance at all. So it will cover all women, including women with POI, which is really important. So we're not, and I've got patients who are 75 on hormone replacement therapy, so there's no end bracket either, which is really important so that we're all covered.
Right. Okay. So everybody is eligible. The
Mhm.
next thing is somebody said, this scheme seems geared towards HRT for women with menopause, but will it extend to women who use HRT to treat something like PCOS?
It's a hormone replacement therapy. So if you have been prescribed hormones on this list and you're a woman in Ireland, then it will be free.
Yeah,
Yeah.
absolutely. Someone asked, is it possible to receive an information booklet with all the information and FAQ included? The answer is no, not
I
yet.
wish we had one.
Exactly,
We're getting one.
exactly.
We're getting one that's updated every 5 minutes.
Yeah,
So I imagine in the future there will be, but again, it
yes,
hasn't been rolled out yet, so it's not live. So we won't be processing any prescriptions until after bank holiday for the free HRT because the systems just aren't there. So it's still changing quite
yeah,
frequently.
absolutely. And bear in mind, this is originally meant to be introduced in January, and
Yes.
it's been pushed out to now, and it's all been very kind of lastminute.com.
Mhm.
But there will be in the future. And then there's a question here is, HRT is used by transgender women treating gender dysphoria. Will they be covered under this scheme?
I don't know is the answer. Again, that's something else that we have to look at. So I think the legislation says HRT for females, but I'm not sure. And I don't know what the definition is. So that's one that we really don't know. And I have patients that are using it that are trans. So, and it's unfortunately it's a question that we've sent into the HSC and I'm waiting for a response.
Okay. And the other thing I was going to say to people is that it's really important that you understand that this is different than the free contraception scheme. So the free
Yes.
contraception scheme involves it covers the cost of the GP visit
Hmm.
as well as the prescription. This only covers the cost of the prescription.
Hmm.
So you still have to go to your GP, your menopause specialist, or whoever it is,
Hmm.
to actually get your to be prescribed or be diagnosed or be treated
Yeah.
or whatever. So
Yeah.
women are still paying for that.
Yeah.
So the answer to that is the doctor visit covered? No, it's not. The prescription, though, is. At
Exactly.
another stage during the conversations, there was a discussion that that women were going to have to pay a dispensing fee.
Yes, not now. So
Not
the government
now.
are going to cover that. Yeah, the government are
Okay,
going to
so
cover
women
that.
will have no out-of-pocket expenditure
None.
going to collect their HRT.
Yeah.
Okay. The next question is there a list of pharmacies who are trained, please? Now, I think that person means in relation to menopause prescribing.
No, no, and
No, there isn't.
there isn't a list of doctors. So basically, I'm under 20 years qualified. I was qualified from the Royal College of Surgeons in Ireland. And we didn't do a whole lot of menopause care and perimenopause care because there was this 20-year glut where a lot of nurses, doctors, and pharmacists just weren't taught it that well, coming out of the WHI study. So it's quite complex. So they're really now only really introducing it. So unless your pharmacist has gone back or your doctor has gone back to do extensive research and their own self-directed learning, like I've probably done probably like a couple of 100 hours of self-directed study. So no, they don't, and there's no caveat for you to have had to do it. So lots of people think that maybe, if you've got a gynecologist in a main hospital in Ireland, that they are specialists in menopause prescribing. No, they're not. They're gynecologists. They might be surgeons. They might be excellent. They might not have done anything like that. Just like your regular GP, who's a wonderful GP and is absolutely, but they're a general practitioner. So, if you want something more specialized, you need to go to someone who's actually trained. So look out for the type of like the menopause hub or lots of other specialist areas. I don't agree with it, but it is just the way it is. So no,
Yeah,
your doctor, pharmacist, and nurse probably aren't trained in it
yeah. I would also say that it depends on the cohort of patients that or customers that a pharmacy has. For
completely.
example, we're on the south side of Dublin. Our
Hmm.
clinic is over the rise in Mount Merion,
Hmm.
and by sheer because of the fact that we're above their pharmacy, a lot of our
Yeah,
patients would have gone into them. So they then
yeah,
quickly became very skilled in sort of menopause, in HRT and all that kind of stuff. And we have a lot
exactly.
of patients coming through.
Yeah,
Another pharmacy that might have, a very young patient cohort,
yeah.
and they mightn't know much about it either. So it's,
Because
yeah,
yeah, but they're excellent at lots of other things. But I suppose everyone has their
exactly.
specialty. So it doesn't mean, and we have a huge knowledge base. But if you maybe don't do very much at all, you're not invested to take that couple of 100 hours of self-directed learning. And we
Exactly.
and we do a lot of self-directed learning. So
Yes.
so I'm not good at lots of different things, but I'm very good
Yeah.
at hormones.
Yes. And our clinic, we only do menopause. So the menopause
Exactly.
hub doctors only do menopause. And so
Yeah.
therefore we've doctors who work 5 days a week and that's all they do. So somebody wants to know is how long does the DPS, so that stands for drug payment scheme, the DPS card last for, and is there expiry date and do you have to renew on a yearly basis?
No, I don't know how many years. I think it could be 5 or 10 years it
Yeah, it's
lasts.
a long
It's
while,
quite a
isn't
long
it?
expiry, but they do expire. And if you move house and things like that, you have to update it. So the best way to do it is to go onto my DPS or have a look online with your PPS number just to check that it's still valid.
Yeah, very good. And I'm just actually Googling here to see is how long it lasts, who can apply, check the status of your application so you can check how long are the cards valid for. So it'll have a valid date on it. I don't even have a
Yeah.
card, I don't think. But
No, you
anyway,
just need the number. You don't need the physical
exactly,
card. Yeah. So it's
exactly.
based
So I
and
think
it's normally your PPS number or your partner's PPS number with
exactly.
the letters on the end.
Yeah, so I think you'll have to look that up yourselves, folks. Sorry,
Yeah.
can't help you with that. The other question I was going to ask is, so we have all covered all the medicines. If you have a query, you can go to pharmacy. I'll put this in the chat. Pharmacy.response@hse.ie.
Hmm.
And let me see. Oh yeah, somebody else asked, do you need to so if you can't get the prescription, so you only get the prescription a month at a time
Yes.
dispensed to you. If So that doesn't mean you have to go back to your doctor every month. No,
No,
it
no,
just
you're
means,
yeah, that
yeah,
the items will only be processed every month through your
yeah.
pharmacy.
And you can put your normal prescription in if you
Yeah,
want and go back every month to
yeah,
collect accordingly. Or you can, move it around if there's a product
exactly.
supply issue. Exactly. Okay, let me see. Are there any other questions? People are saying they can't see any links. So, oh, sorry, my GPS didn't come up as a link because there's a dot after it. Sorry, I'll copy that now. This should work. Is that a link? No. Oh, sorry, it doesn't work. I'll get it.
So it's my
Um,
DPS.ie. If you just
yeah.
Google that, it comes up quite quickly. So that again,
Um,
that's the HSC side. So I imagine the systems are probably red hot at the moment, but it's definitely worth making
well,
sure
you
that you're
see, I don't know that they'll be red hot at the moment because I don't know who's dispensing this. Not dispensing is the wrong word, but I don't know who's actually giving out this information other than,
yeah,
this webinar. So if I were you, I'd get
yeah,
onto it. Sorry, there's the link now. My apologies.
right,
And what I would suggest people do is get on immediately after this
yeah,
webinar if you're not sure about your own DPS
100%.
status or whatever.
Yeah.
Yeah. And some of the other questions were, if you're not Irish and you're here visiting, which probably doesn't affect anyone on this, can
Hmm.
I actually get avail of the free HRT scheme? And I
If
know
you
the
have a
answer,
PPS number and you have a DPS, if you're an
yes,
Irish resident, yes,
yeah. But if you're not, the answer is no.
yeah.
Let me see. Is there anything else? Oh, yes. Will emergency supplies of HRT be facilitated under this arrangement?
Well, emergency supply. It really does depend. So emergency supply is really in the event of, a woman having an emergency in the sense that she would normally. So for instance, if Loretta, you come to Bonnybrook Pharmacy and you would have your prescription that's regular with this pharmacy. So I have a list of all your medications. I know when you get them and what you get. And your doctor had gone away for a month and you need an emergency supply. It is up to the pharmacist to use their professional judgment to decide if it is warranted that we can give an emergency supply. I can't just walk into a pharmacy who doesn't know me and I don't have a prescription and demand HRT. So it doesn't work like that. So that's a very nuanced question. So there isn't, it's a case by case basis. It depends on what the medication is. Some of it you can't give due to regulations. And otherwise, we would give the lowest amount possible for the few days. So really, it's a very nuanced thing and it's not used that often.
Okay, but you would still get it free.
I imagine so. But
Yeah,
again,
so would I.
yeah, I don't
It says
imagine
here
why
on the
would it
Q
not?
on the the FAQ thing I'm looking at is current emergency supply protocols will apply to this arrangement.
Yeah, yeah, I
Yeah,
imagine so.
okay.
Yeah.
And the other, what was the other question? Oh yeah, there's a thing here that, if you pay privately for this
Hmm.
yourself, then you can't claim back from the HSE or anything like that. There's no
No.
facility. It's all done at the pharmacy level.
Hmm.
So, and there's no reason you should be paying privately unless you don't have
Hmm.
the DPS registration.
Hmm.
And the other thing is that when it comes to the end of the year and you do your Med 1 for your tax refund,
Hmm.
you can't claim for this because you haven't paid for the medication. So that's
Exactly. So
just from the
yeah.
taxation perspective at the
Hmm.
end of the year. Okay.
Yeah.
Let me see, is there any more questions? Let me see, are we up to date? So I've checked my own pharmacy and confirmed they are on the scheme. So presumably, some pharmacies may not opt for this to be part of the scheme. Is that right?
Yeah, like it is a loss-making scheme for pharmacies. So that's another reason why it would be unfair to just, if you have a three-item HRT prescription, to just get one item in a pharmacy. If you're going to give them the business, get the three items there because we put in a lot of time and effort, but we're losing a significant amount of money every month. But the reason we've had to do it is that the minister has said that the money that's out there for pharmacy to advance our services. So we haven't had any pay change in 17 years. I'm not sure if you have been paid the same for the last 17 years. I don't know if anyone would. But she basically said they wouldn't really negotiate anything if we didn't take it and that the money would go to elsewhere. So we didn't really have an option. So the minister was very persuasive, let's say. So we didn't really have a choice. So it's what we're doing at the moment. But yeah.
Okay. So you may need to check that your pharmacy is a participant in the scheme. Actually,
Yeah,
that's
some
probably
people
the
won't
first
be.
thing you do. Yeah,
Hmm.
absolutely. But then you can take that prescription or get that prescription sent to a
Exactly.
pharmacy that is on the scheme.
Exactly.
Okay, somebody asked, is are progesterone applicators included under the scheme?
So they ask your pharmacy, so there's only one version of progesterone in Ireland that's unlicensed that has an applicator. And as far as I know, I think they are going to be covered. But most people would just use your finger unless there is an issue because you're just popping it straight into the vagina at night. Or most people, the majority of women would use it orally as the licensed indication. So not that many women would use it vaginally. And the ones that do, yes, the ones with applicators should be covered.
Brilliant. So I'm not sure if we have any other questions, so I'll happily take any other questions.
Yeah.
I'll happily look into the Q&A. So we have looked in the Q&A. No, oh, so here we go. Will there be a fee item per the HRT for the
No.
HRT? No. Prescriptions are emailed. Are they transferable from one pharmacy to another?
Yes.
Yes. Are there any age restrictions? No.
No.
Can we access that reimbursable list? Is that the one
I
of the?
think it's on the HSC. To be honest, again, as I said, it's changing for us, but I'm imagine it's on the HSC somewhere. We have it on our unions page, and on a secure site. But I imagine, as I said, we're literally having to run the finish line to get this over the finish line. So it really is quite up in the air. But I imagine there will be a list in the next few weeks that people can access. But really, you can check with your doctor also, they'll have access to the list. But most things, most regular HRT items that I see prescribed at Bonnybrook Pharmacy will be covered. So really, there's going to be an alternative for most people, since all your testosterones are going to be covered, your vaginal estrogens, your oral estrogens, your patches, your gels, your sprays, they're all covered. So really, it's more obscure things that won't be. And don't forget, it is just for hormone replacement therapy. So if you're using it for IVF and things like that, those things I don't think will be covered.
And then somebody just said there you can just Google the list and print it off. So there you
Great.
go.
There we go.
Um, Somebody asked about possible to receive an information booklet. No, with
Yeah.
FAQs, no.
Yeah.
Somebody here has a question which isn't necessarily related to the scheme, but said, could I ask you, and we can ask you this, Victoria, the
Yeah.
best way to apply 3 pumps of estrogel as I have changed from the patch? I want to make sure that I'm using it correctly. 75 micrograms, please.
Yes. So normally people would use a bottle of estrogel, something like that. Make sure that you have primed your bottle. And if they actually follow my page, I do a couple of different videos on this. You prime the bottle. The first dose or two is just discarded. And then once your dose is primed, you would put it on to dry skin. So after your shower and it's not moisturized, use your upper arms, lower arms on either arm or your inner thighs. So normally if you're on 75, which is 3 pumps a day, you'd want to make sure that you're pushing all the way down so that each pump is actuated properly and not just a little pump. You want a proper measured dose, and you put it on your hand and you would just rub it on to your arm like that. That's 1 pump, and that's enough rubbing. You don't just have to glide it on, actually rub it in. So you can put it onto your upper arms, your lower arms, or your inner thighs. So some women choose to put all three on at once in different areas. So 1 pump on one area, second pump on another area, and your third pump on another area. Or you could use 1 pump on each arm and then 1 pump in the evening. So a lot of people find they get this nicer steady state if they do 2 pumps in the morning and one in that evening, and then continue that every single day. So really it's up to yourself, but just to make sure, there is a couple of videos online and I have done a couple of on my page as well. So have a look at those.
I remember a poor woman who came to our clinic had said she used to wait for about 2 hours for it to dry before
Oh,
she went swimming. So I don't think you need to be waiting that much time.
no.
Um,
It is about an hour, but with swimming, I just say if you're swimming every day, start putting it on after your swim because let's face it, it's so important that we absorb as much as we can. I just wouldn't risk it. If you normally go swimming in the morning, have a shower when you get home, put it on then, or put it on in the evening, as long as it's consistent. That's the best way to get a steady state.
mm, Brilliant. Okay, thank you very much for that.
No problem.
There's another thing here. So, say for example, I'm on a 100 patch, and the 100 patch is out of stock, and the
Yes.
pharmacy says to me, "Look, I can give you two
Yeah.
50s."
Yeah.
Are they both covered under this?
Yeah, they should be.
Yeah.
Yeah, once your prescription. So again, it'll be a real nuanced thing, but because we're having such shortages, absolutely. So, for instance, we have Estradiol 37.5 in stock, and we also have an American boxed version. And 75 of Estradiol hasn't been around for 9 months, maybe now, nearly a year in Ireland. We haven't had any stock. So women have had to wear 2 patches, and absolutely that's covered. So it is just like any other medicines. When one is short, you would then augment that to make up the correct dose.
Brilliant. Somebody else says here, I'm used to being put on a 3 month, but you might understand this better than I do, on a 3 month pack. I'm used to being put on a 3 month pack, usually for my HRT. Will the pack be split or I'll be assigned the 1 month pack version only? Do you know what that
So
means?
yeah, and most HRT, so no, it's just going to be 1 month at a time. So
That's what I thought. Yeah.
yeah, that's it.
Yeah.
Just 1 month at a time. Yeah.
Okay, grand. I'm on the gel, but one bottle doesn't cover a month because of the amount of pumps I'm on. Can I get a second bottle free with that month? Is it based on dosage?
So if a prescription comes into us and someone is on Estrogel and they're on 2 pumps a day, 1 bottle will suffice. So that's what they'd get because their prescription has 50 micrograms, which is 1 bottle. If you're on 75, you're going to need a bottle and a half. So you would then be given 2 bottles every month. And people who are on 4 pumps a day, again, 2 bottles. So it's just
Okay.
what is written on your prescription.
Yeah. Okay. So you will get more than the one bottle.
Yes.
Then there was somebody saying that the chat isn't working, but I don't know why that isn't because I put it into everybody.
Yeah.
But the chat is DPS, my DPS. So my D for Derek, P for Patrick, S for Sean,
Yeah.
.ie is the thing you go on to.
Yes.
There's a question here about how long to stay in HRT, which is not necessarily related to free HRT, but I don't know,
Yeah.
for Victoria, if you're happy to answer that.
Yeah.
Yeah,
It's a real nuanced thing. So I suppose I started so it's like everyone, like it's like saying, when does everyone get their first period? It completely changes. But some people get it at 10, some people get it at 15, some people get it at 17. So like that, everyone's hormonal journey is totally different. So for me, I started HRT when I was 40. It's quite young, my perimenopausal journey, but it changed my life for the better. And now my risk factors for cardiovascular disease, strokes and heart attacks, and even some evidence to say dementia are greatly reduced, and lots of cancers. So for me, it's a personal journey. And while the benefits outweigh the risks for me, I will stay on it for as long as possible. So there is no arbitrary figure like 5 years or 10 years, or there's no date or age that you need to come off your HRT. It needs to be reviewed, obviously, at least annually. So we find that women who are, just say, 40 or 45 are not on the same dose of estrogen as maybe my patients who are 85 or 75. But I have plenty of patients in their 70s and even some in their 80s. And they usually tend to be on a smaller amount, but it suffices and it really helps them in their day to day. And they are reduced for lots of different risk factors. So they will have, they will age better, and it's really up to the person. So yeah, it's totally individual.
in the Menopause Hub, and according to the British Menopause Society guidelines, it's usually when, as long as the benefits outweigh the risks. So
Exactly.
if something happens to your health that changes your risk profile, then it will obviously need to be reviewed.
Exactly.
But as long as the benefits outweigh the risks to you, then
Hmm.
it's indefinite.
Yeah. And
The
that choice is a choice that's made between the doctor
you
and
and
the
yeah,
patient.
yeah,
It's
it
discussion
should
that
be.
needs to be had. It's not from one side or the other.
Yeah, it should be collaborative, absolutely.
Yeah.
There's another question here, which is, does it matter if you're paying less than the €80 for your monthly prescriptions in total? So say I don't get any other prescriptions and the only one I get is my HRT.
It's
It
going to
will
be
still
free.
be free. Still
Yeah.
be
So
free. You
just
don't
say
have to
you
spend the minimum 80.
No. So basically, if you come into me and you get an inhaler and you get your HRT, and you usually pay about €40, now the cost of the HRT will be taken away and you'll only pay for the inhaler, which is not related to hormones. So
Yeah,
you might be paying €10 for your
yeah.
inhaler or whatever. So your HRT part of it will be free.
It is a massive benefit to women, like it really is.
Yeah.
And I
Yeah.
know there's women who, are what I call the squeeze middle, who can't, aren't on a medical card or and then can't
Yeah.
afford HRT.
Yeah.
So,
Yeah.
for them it would be, and then you can spend that money on something else. For
Exactly.
yourself, hopefully, and not
Yeah.
just the
Yeah.
family, but depends on your personal circumstances. And I'm just going to check. So that was in the chat, sorry, in the Q&A.
Mhm.
The next question is, oh yeah, somebody said, and I'm not really sure I understand this question, but
Mhm.
can I ask if there are any natural hormones on the list, or are they primarily synthetic?
So no, lots of natural hormones. So a lot of the transdermal estrogens, like your estrogel and your patches and that, all the newer type estrogens are what's known as body identical estrogens. So they're usually sourced from the same chemicals as female estrogen. So the older style synthetic estrogens that you would take orally, like Premarin and things like that, they're synthetic estrogens and progesterones. They're not really prescribed all that much anymore. 95% of women would be prescribed the natural hormone, which is exactly identical to
True.
female estrogen, and progesterone would be Utrogestin and estrogel or Lenzetto. So it once no, so things have come on greatly. But again, you need to go to your doctor or pharmacy that understands that. Yeah.
Yeah. And the other thing I would say is that I don't know whether this woman is actually referring to things like compounded hormones, and if you are,
Yeah.
they wouldn't be part of the scheme at all. This
No.
is
But
all
there's no in
your
Ireland, yeah, it's not even legal in Ireland.
exactly.
Yeah, it's
Yeah.
not, they can't
Yeah.
stand over the efficacy of them. So yeah,
Yeah.
it's not
Yeah.
licensed. Yeah.
So someone else says with estrogen, oh, this is sort of related to not necessarily the scheme as such. With
Mhm.
estrogel, how long should you wait before making skin-to-skin contact with your partner or
It
child
really
or baby?
depends. Yeah, well, so there is normally on arms, you only need to wait 5 minutes and then it's dry and then you cover it. Very rarely, you'll never put it near your breast anyway. So the amount of touching that would going on is quite small. It's absolute minimum. Like you only absorb about 10% through your skin anyway. And then for it to dry and then transfer, the amount would be absolutely minimum. I think there was a study done on men using very high doses of testosterone on their chest area and then putting a baby on top for prolonged periods of time. So I think that's sometimes where the confusion comes about transfer. The transfer is very nominal, but always be aware of it. You want to be washing your hands after you apply your gel. You want to wait till it's dry. And as the directions say, you cover it so that there isn't that, contact. And you can use your inner thighs as well for estrogels and things like that. So I would say just, invoke your common sense, really more than anything. And if you have any queries, check with your own pharmacy.
Yeah, brilliant. Thank you. And then I've just one
Okay.
last question, which somebody
Yeah.
said, sorry, I came in a bit late. Am I right in this takeaway? So the answer is, so let me reiterate this. So if you're part of the DPS scheme,
Hmm.
everything will be fine. If you're
Yes.
not part of the DPS scheme, then therefore you should register using the link mydps.ie. And I
Yeah.
would
You have
advise
to
you to
be.
do that
Yeah.
after this webinar so that
Yes.
you're ready for June the 1st.
Yeah.
The second thing I would say is that if you don't need your prescription on June the 1st, and I don't,
Yes.
please give the pharmacist a chance and go.
Couple
You
of
can
weeks.
go and get them when it's actually due. The
Exactly.
third thing to say is that most hormone replacement therapy products, with the exception of Invagis and Androfem, which is
Hmm.
the Australian testosterone,
Hmm.
all of them are covered.
Hmm.
There's no age group that's excluded. So any woman and anyone who's being prescribed hormone replacement therapy for whatever the purpose
Hmm.
can be on this. We don't know about transgender and people who are being treated hormonally for that. So we
Hmm.
don't know enough about that. But for everyone else, including anyone who's on it for PCOS or POI or anything like that, will be able to get the hormone replacement therapy for free.
Hmm.
Um, if you go to your pharmacy and they don't have the stock, you can ask the pharmacist to send your prescription electronically to another pharmacy.
Hmm.
You also don't have to stick with the pharmacy that dispenses your €80 amount of medication. You can go anywhere you like with this prescription.
Hmm.
And if there's shortages, the shortages are likely to be covered if there's stuff out of stock. And they're
Wonderful.
working to have all those covered.
Yeah.
Yeah, I think it seems to be they seem to be the key questions to
Yeah.
be asked. And then obviously check if your pharmacist or pharmacy rather has signed up to the scheme, because if they haven't,
Yes.
then you might have an issue and you need to go somewhere that does.
Yeah. Yeah.
And yeah, and where possible, go to people who know about this stuff. So the Menopause
Exactly.
Hub is one place if you're and particular pharmacies like yourselves. And there's stuff on social media as well that you can follow us or follow you, Victoria,
Exactly.
the menopause pharmacist, and you can get any information after that.
Yeah.
And if you don't spend up to €80 on medications, you're still going to get your HRT for free.
You are.
Yeah,
Absolutely.
okay.
So and you just have to have a DPS. That's it. It's
Yeah.
easy.
Okay, brilliant. So I think everybody, now one other question which came is,
Hmm.
does the prescription need to have your DPS number on it or
No, it's helpful.
your
So
PPS?
No, but it's helpful. So if a lot of patients, if we don't have them registered for the DPS scheme, it's very helpful for your pharmacy to have it on it. So a lot of doctors now are adding it onto the prescription along with
Okay.
all the other details. So we often see date of births for adult prescriptions. We don't necessarily need the date of birth for an adult prescription, but it's handy to have on the system. And the PPS is really important now for us to be able to process it through the
Okay.
drug payment scheme. So if you have never had a drug payment scheme, you will need to get that set up to get your free
Yes,
HRT. So that's really
absolutely.
important. Yeah.
Yeah, yeah.
Yeah.
So two quick things out of today. Go and find out if your local pharmacy is part of the scheme and
Yes.
sign up to DPS if you're not already signed up. They're your
Yes.
two key actions. Otherwise, all will be well, we hope.
Exactly. Fingers crossed.
And is there anywhere on the prescription in particular that you need the PPS number
No,
now?
no,
Yeah.
anywhere be great. So
Okay,
some people put
brilliant.
it under the address, or the doctors have different ways of putting it in, or sometimes they do it
Okay.
as a drug underneath. So
Yeah, I'm
anywhere
only asking
is
that
great.
from our
Yes.
perspective as a clinics. Okay, I think we've answered everything, unless
Great.
anybody has anything else. No.
Yeah,
Okay, brilliant. I'm delighted that we're able to help so many different women
me
with this
too.
because it can be confusing. Thank you,
Oh, so
Victoria, for your
confusing.
time.
Of course,
Brilliant.
no problem, no
Thank you.
problem. No problem. See you later, Loretta.
Thank
Bye.
you. Bye bye.
Bye.